Hey residents, welcome back. And in case you didn't see the introduction or the first video on the channel, just a little review. This channel is really for the OB-GYN residents that are doing general clubs and are maybe looking for some ideas, some evidence-based stuff. And really what this all came from, or what it spawned from, is the fact that in your programs when it comes to menopause management, it's pretty lacking. And when you get out in the real world, there's a lot of things you're going to come up against so far as women presenting with peri and postmenopausal symptoms, and there's so much data out there, and there's a lot of opposing opinions and ideas. It's almost political on how to treat these patients. So what we want to do is just kind of maybe level the playing field and just give you some good evidence-based tools that you can use, and in the meantime, maybe some good journal club ideas. But anyway, that's the purpose of the channel. So that brings me to the first study, which pretty much sums up pretty much what I said. And I'll put a link, how to download this article if you want it down below, so you don't have to catch that on the video. But the study design, or the title, is Needs Assessment of Menopause Education in United States Obstetrics and Gynecology Residency Programs. And it was actually published, I'm not sure of the month, volume 30, number 10, 2023, by the Menopause Society. So, some key points here. The objective, it's a national survey of program directors, and it went out to 145 U.S.-based OB-GYN program directors with 15 questions, really asking about their menopause training for residents in their programs. So what they found is that only about 29.3% of the programs have a dedicated time assigned to a menopause clinic, which is kind of lacking. The access to a standardized menopause curriculum is really low. And when you look at the kind of the conclusions, pretty much straight across the board, a standardized menopause curriculum is really lacking. Now here's an interesting statistic that might affect you or might not, but by the year 2060, there'll be 90 million women in the United States in postmenopause. I won't be here. If you're a first-year resident, you might be here in 2060, and I hope you are. But anyway, interesting fact, just the fact that menopause is just going to be so much part of your practice when you get out. So again, it's kind of a common theme that most residents reported that they had limited knowledge, and they really wanted to follow up and learn more about menopause medicine. And then they further asked, what do the residents want to learn about? What are you interested in? And the top ones here are pathophysiology, hormone therapy, non-hormone therapy, bone health, cardiovascular disease, and metabolic syndrome. Those are the top areas that were interested from you, the residents that were responding to the survey. And then only 16% of the programs had a defined menopause clinic that they could actually rotate through and answer some of those questions. So going on to the next page, again, the same theme. There's not a standardized menopause curriculum. Residents don't have access to a menopause clinic, a menopause expert, or a designated menopause curriculum at their institution. And then I'll just get to the conclusion here. And what they found, just in summary, is that OB-GYN training programs should contain an effective menopause curriculum to educate residents. This study suggests that nationally, most training programs lack the curriculum necessary to effectively prepare residents to manage menopausal patients. An obvious need exists among programs to implement a well-developed standardized national menopause curriculum to equip OB-GYN trainees for future practice and care of menopausal patients. So it's an interesting article, and I've found this in my other life to be very true. It's mostly obstetrics, surgical stuff, and just a lacking of menopause management, and that's going to be part of the curriculum, or the goal of this channel is to help you guys in your journal clubs, and hopefully you can get some good resources on menopause management here as well. So, okay, that was that, and on to the next study. Thank you.